Hi, today's video tackles the question, is India undercounting deaths by COVID-19 and why does it matter? The short answer is yes, we are. Before I go further, the content of this video and images are disturbing. I would urge you to pause here, leave the video if you're navigating a tough situation or are anxious and overwhelmed with all that's happening. Let's give it a moment. So yes, we are reporting less deaths. It's evident from the difference between records kept by various state governments and visuals from the ground. We have almost become numb to the imagery of mass cremations, of bodies in line waiting to be cremated, of hospitals and morgues filled to capacity, of rows of ambulances and mourners lined up outside crematoriums waiting for their turn, of furnaces melting and becoming red hot due to 24/7 cremations. It simply doesn't add up. I'll tackle why, as a journalist and a photojournalist, it is important that this coverage is brought to you a little later in the video. But in one line, a plethora of media reports show that on most days in April, COVID-19 funerals at a single crematorium in one city sometimes exceeded the reported total death toll of the entire state. In Uttar Pradesh, the official COVID death toll for the entire state on April 11 was 72. The print reported that crematoriums in just Lucknow handled 69 bodies with COVID-19 protocol on the same day. In Bangalore, COVID-related deaths registered were twice the official data throughout April, according to The Guardian. The Karnataka government had to allow cremations on privately owned land because they were running out of space. In another one, NDTV found 1,150 COVID deaths missing from the Delhi government's official data between April 18th and 24th. Madhya Pradesh, same story. Officially 37 COVID deaths on April 12th in the state, but Bhopal alone had 37 funerals at one single crematorium the same day, according to local media and NDTV. The same is happening in Gujarat, Telangana, Kerala. Now, state chief ministers have responded to this in the most bizarre ways. The Madhya Pradesh Home Minister said, "Why would anyone hide the actual COVID-19 death figures? It is a pandemic. People are not dying in riots." As if riots are a good reason to hide deaths. The Haryana Chief Minister said, अब जिसकी डेथ हो गई है वो वापस हमारे शोर मचाने से तो जीवित नहीं हो जाएगा. The Gujarat Chief Minister said that they were not recording all deaths of COVID-19 patients because of ICMR guidelines which say deaths of COVID-positive people with serious comorbidities is not attributed to the disease. This is categorically false. It is misinformation, and it brings me to the next point. How are deaths by COVID-19 recorded? Deaths have to be medically certified by a doctor in a hospital as a COVID-19 death for it to be counted. Now, even before the pandemic, it is believed India registered only about 86% of deaths. This means death certificates were handed. And from this 86%, only a fifth had a doctor actually medically certifying the reason for the death. Now, in the times of a pandemic, against the ICMR guidelines, number one, suspected COVID-19 deaths are not counted. Those who test negative but show symptoms of COVID-19 are not counted. Number two, in the case of deaths of COVID-positive people with comorbidities, the listed primary cause is often a non-COVID factor. For instance, the person died of kidney failure but was COVID positive. Let's zoom out further. Deaths at home of those with COVID-19 symptoms are not counted, whether they tested positive, negative, false negative, or were even waiting for their results. Deaths in ambulances, waiting rooms, outside clinics are not counted because they couldn't get a hospital bed. Those who died due to COVID-19 in, let's say, rural and tribal areas where all of this registration and a paperwork is a bit of a cruel joke, again not counted. So, net, yes, India is undercounting deaths, and no expert or statistician is really in two minds about this. The difference is only by how much are we undercounting. We won't have a final answer till we at least acknowledge that there are gaps in our data, just as they have been across the world. Experts like Prabhat Jha, who led India's ambitious million death study, one of the largest on premature mortality in the world, estimates that all countries have undercounted initial COVID-19 deaths by 30 to 50%. And most have undertaken massive data reconciliation exercises, which has increased their death tolls. Now, why is it important to count our debt? It feels odd that I'm having to ask this question, but it is important for a whole host of reasons. Number one, it allows governments to manage the pandemic better. Number two, we don't live in denial about what's happening. Number three, our citizens get the right public health communication. So we don't become complacent, we don't stop wearing masks or attending big gatherings. Acknowledging these deaths is the least we owe the people who are likely to become mere statistics. Accurate fatality data can be used to predict the impact or the severity of future waves. It also tells us which communities are more impacted than others, so services and provisions can be distributed in a way that brings down inequities. On a day our official death toll crossed 2 lakh, the health minister spoke of India's fatality rate as the lowest in the world. The health ministry has been touting our highest recovery rate, least number of deaths, especially among young people, and so saying that we are winning against the disease. Calculations by the Center for Disease Dynamics, Economics and Policy show that Indians between the ages of 30 and 70 are much more likely to die from the disease than people of similar ages in China, the US, and Brazil. That is, that the claim that we have a lower fatality rate is not borne out by the data. And that's why it's important we fix our data. And that's what makes it important for journalists and photographers to show that the data is faulty and shoot and capture those images from cremation grounds. They're not pretty, they're not easy, but photographers facing flack for debasing a sacred religious process or selling their souls are actually doing valuable service. And yes, this is my opinion. And countless conversations have revealed that they've done this in the most sensitive, humane, and empathetic way, often families asking them to do so. The indignity is in mass cremations or families unable to get a space for last rites or tin walls in front of cremation grounds. The dignity is in first acknowledging that these deaths happened. We'll stop here for now. If you have been watching, thank you for your time.